The number of cases involving unexplained liver issues in kids is climbing, and American health officials are investigating what could be the country's first death tied to it. Late last week, the World Health Organization says about 170 cases have been reported in 16 countries so far, and that's up from 74 cases in just the UK 2 weeks ago. Dr. Katie McCougan, who is a pediatrician with Nemours Children's Health and Wolfson's Children's Hospital, joins us live this morning. Thank you so much for joining us.
Good morning.
Can you tell us what are some of the unexplained liver issues that we're seeing in children?
So we have seen an increase in cases of hepatitis or inflammation of the liver in our pediatric patients. At Wolfson Children's Hospital, we have not identified adenovirus as the underlying cause, as was seen in the cluster of cases in Alabama recently.
And what are some telltale signs of hepatitis? And is there one that really should set off an alarm to parents?
If the child develops yellowing of the eyes or skin, that typically could be a sign that there is hepatitis, along with an increase in easy bleeding or bruising. And often the diagnosis is confirmed by the physician running a series of blood tests.
And can you tell us, how is hepatitis linked to liver issues in kids?
So hepatitis is the term for inflammation in the liver. And if there's just inflammation, it may not be a serious illness for the child. But if it starts to affect how the liver is functioning, that could lead to acute liver failure, as has been seen in some of these recent cases.
And what is the most common type of hepatitis that children may have?
Autoimmune hepatitis is one of the most common that we see, along with various viruses such as Epstein-Barr virus or cytomegalovirus, along with your typical hepatitis A, B, and C.
And is there a reason that doctors are saying that there is an uptick? What is backing that information, and what should we be aware of?
We don't know exactly why there has been this recent increase in cases. We do know that with coronavirus, even though that has not been the underlying cause of these recent cases of hepatitis, the viruses in the environment do interact with each other. For instance, that is likely one of the reasons why we haven't seen as much influenza these past 2 winters, is because of the increase of coronavirus cases. So we do know that the viruses interact, and this may be allowing the adenovirus, typical strain that is causing some of these cases of hepatitis to come out or be more prominent.
And I think you did mention earlier that we have seen a rise in cases here locally.
Yes, fortunately, we have not seen cases of acute liver failure on a regular basis due to these viral causes of hepatitis. Most of them are more acute, limited cases in children where they become ill from the virus and show signs of hepatitis, but then they recover.
And real quick before we go, what can parents do to help reduce a child's risk of getting hepatitis?
Just keeping them healthy in general, and making sure they have a healthy diet and are getting enough sunshine and vitamin D can all be helpful for their immune system.
All right. Well, this is wonderful information. Thank you so much for joining us this morning.
Thank you.